Well, good morning. And once again, welcome to another live this morning, question and answer Friday. And always a lot of fun. A lot of fun for me anyways. And here we go. Got a few people coming on. Good morning, Francis Marie and Rosalinda. Nice to have you on this morning. Rosa, Sarah, and John. Good morning, John. Doretta, nice to have you on. Nativity, and Judith, and Nick from our staff. Good morning to you guys. Connie, good morning. And Tammy, thanks for coming on. We appreciate you guys. Mike from Wawa, and Mary, good morning. Erna, nice to have you on. Len and Judy from Edmonton, bright and early this morning. And Eileen from Georgina. Joy. Nicole, good morning. Jerry, Nouveau Brunswick. Wendy from Markham, good morning. Janice, nice to have you on this morning. Connie, good morning to you. And Dan, good morning. Angelina, our dear friend, Dr. McEwen, good morning. West Tennessee, Maryland, Judy, and Diane. Question and answer Friday. We're getting ready to roll it out. Paulette, good morning. Lise and Rita. You guys are much appreciated. Jordan from Tennessee. Yvette from Cornwall. Good morning, Sue. How are you? And Katharina. Okay, a couple of more and we'll get going. Chantal. And right from Sudbury. Wow. Kathy. Louise. And Jeanette. Donna. And Darlene. Okay, guys. Babika. Good morning to you. And Fran. Okay, Sandra. Brampton. Here we go. Okay, let's get to those questions. I'll come on afterwards and say hi to you. John is wondering about my take on the idea that a caloric deficit is the main driver of weight loss, assuming that macros and within normal parameters. I know there's a lot out there, John, about weight loss. Calories, is it really calories? When you're, even eating keto, you're losing weight because of calories. Maybe to some extent, John, that's true. Although I'm not big at all on calories. Even for weight loss, I'm not a big believer in it. And really, I never have been. The day you start counting calories is really what the yo-yo dieting is all about. Eat less and move more. I mean, guys, that's been since the 1960s and the early 70s. Eat less calories, and you will lose weight. I guess so. And I think you know this, John. I mean, if you followed me at all over the last little bit, you would know that I am a big guy on changing fuels. You just never hear me talking about calories, and there's a reason for it. I know it exists. Calories exist. But there's a reason for my thinking. Because, if you have a piece of steak, there's a fair amount of calories in that. But how your body takes that in and burns it is a completely different process from how your body takes in a piece of cake and burns that. And the key to all of it, John, is not calories. It's insulin. And if you want, you can call me Dr. Insulin, because I'm a guy big on insulin. if you can lower insulin resistance, you get the people that are on our weight loss program on the reset. It's not, primarily it's to fix your metabolism, and weight loss happens to be one of the benefits. But it's not yo-yo. It isn't, because the reset is meant to fix your hormones. Because when you have trouble losing weight, you got problems with hormones. Your hormones are mixed up. You're hungry all the time. And for a lot of women especially, they just look at food and gain weight. They don't even have to eat it. They work out. They're disciplined. This is general, okay? Just a general statement. Somebody said online the other day that I'm insulting to men. My husband won't listen to you because you're insulting men in general. Yeah, I go after men. It's true. I was always known more as a woman's doctor because I tested hormones. And it's not that men don't have hormones. Of course they do. But they don't have the balancing act that women have. Men don't have to balance anything. Women have got a lot of moving parts to their thyroid and to their adrenals and to those beautiful ovaries that are releasing estrogen and progesterone. I tell you, that makes for hormones in a lot of cases, okay? So a woman that has hormone problems better not be counting calories. They won't do well. They will be on the constant yo-yo dieting. And that's what I don't like. And to me, it's temporary. You starve yourself. You see, I want you at the cellular level, John. I want you at the cellular level to give your body the best fuel. The best fuel are relatively high in calories. But again, it's insulin. It's insulin. You have to fix that. And it's amazing when you fix insulin resistance, what happens with the human body. And this was done, I tell you guys, by trial and error at the Martin Clinic. Because, you name the diet. I've written books on diets. And I wrote a book years ago. It's got to be 30 plus years ago on get rid of yo-yo dieting. Quit counting calories. Don't count. I don't want you to count. I want you to change fuels. Okay? But thanks for the question, John. It's a good question because I'm sure it's always going to be out there, brought to you by the food industry. The food industry. Okay. Karen, lipedema. Apparently 10% have it and don't know. Now, I just want to make sure, Karen, that, lipedema is when you have swollen legs. Okay? Edema in the legs. And usually in women. Their legs swell. Why? Well, look, I always tell, because whenever I saw it of course, I was doing biomarkers. I was checking kidney function and liver function and, these kind of things. At the end of the day, sometimes it just, it can be genetics. To some extent, sometimes it's just the way it was for certain people. And, it was hard to pinpoint. A lot of times I found that the kidneys weren't flushing properly and the body was holding on to fluid. We talked about salts this week and, what happens inside the cell, potassium inside, salt on the outside of the cell, two oceans, and you better get balance. And then sometimes that was the case. But it's not always easy to get rid of, okay? And, one of the things I do recommend, by the way, for lipedema, DEMA, is a rebounder. I really like the rebounder, okay? And I just find that, that mini trampoline is really, really good for anything circulation. It's good for your lymphatics. I really like it, okay? Paulette is asking, what's my take on benfotiamine to help combat the effects of glycation? Well, benfotiamine is B1. I think I answered this, I thought, a couple of weeks ago, but maybe it wasn't about glycation. I wouldn't take it as a supplement. Look, B vitamins are very important, guys. B vitamins are very important. But I think, again, if you know me, I don't talk about taking a B complex. I don't talk about taking benfotiamine, which is a synthetic. That's what it is. That was the word I was looking for. A synthetic form of B1. I know it's out there. You can take it as a supplement. But for glycation, it's food. Glycation is literal AGE, okay? Advanced glycation end products. You know what that means? Your body's aging. Your muscles are aging. Your cells are aging. It's a form of oxidative damage. Number one thing is not a B vitamin to help that. The number one thing is do the reset and get off sugars, because there's nothing that will cause glycation more than sugar. Sugar, guys, think about this for a minute. Think about this. Kids find this out with cavities, okay? And a dentist, when he sees cavities, will usually tell you that you're eating too much sugar. I mean, even as kids, we knew that. Even in going to the dentist in the 1950s, the dentist would tell you that sugar is destroying your teeth. Okay? And you need to brush your teeth and all that, of course. No, but seriously, they knew it then. If sugar does that to your enamel, which is one of the hardest substances in your body, imagine what sugar is doing to your organs, your liver, your kidneys, your pancreas, your skin. I mean, it can destroy your enamel. Glycation is sugar. So you can take all the B1s, B2s, B3s, all the B vitamins, and you're not fixing glycation unless you change your diet. Okay? You're not going to change oxidation, because really glycation, it's a form of it. It's a form of aging in the body. Caramelization of your joints in that. How does that happen? Why is sugar? Because think of what sugar does to your teeth. So, I'm not big on supplementing B vitamins except for B12. Because that's the one that about 80% of the population don't get enough of. They don't eat enough red meat. That's how you get B12. Plus, any kind of digestive issue. And even on the best of days, you're not absorbing vitamin B12. It's a hard, finicky vitamin. And this is why when I talk about supplementing with B12, I think there's a question about it this morning. We'll get to it. But glycation, guys, is food. If you want to take antioxidants and all that, I love Navitol. You guys know that about me. There's nothing like pine bark extract. But glycation, if you don't change your diet, if you don't get rid of the sugar, if you do nothing else but get rid of sugar, sugar is very acidic. Okay? They always blame meat for being acidic. But you have a buffer. Your body's smart. It'll produce baking soda. It'll make you alkaline. It keeps your blood alkaline. But sugar, very acidic. Very acidic. And it's very destructive. And the food industry don't like to tell you that, but I'll tell you that 7 days a week, 24 hours a day. Okay? Good questions. Okay. Violet. Dr. Martin had mentioned that putting things on the skin with chemicals, then being in the sun is not good. True. So that would go for tanning lotions in the sun and tanning beds, I presume. Well, look, tanning lotions, if you put something natural on your skin, like olive oil, coconut oil, they have some protective qualities to them. Okay? I like a Rivera. Again, it's pine bark. And again, on the skin. I love that. You can go in the sun with it because it's completely natural. It's when you put chemicals. Chemicals and heat don't go well together. And isn't it interesting that they have recalled, thousands of products, sunscreens, because that even the FDA is admitting they're carcinogenic. Wow. I hate to say I told you so. But if you can't pronounce what's on that label, don't put it on your skin, guys. And then don't bake in it. Okay, good question. Tanning beds, look. You don't hear me talking about it much because people need to be very careful with that. Very careful with that. And I wouldn't make it a habit of any kind. Look, you got to be careful. I'd much rather you go in the sun, get 20 minutes. I did 20 minutes yesterday, in pure sun. I got my Viderma yesterday. You? When it's nice out, I get my Viderma. I don't burn. I try and be very careful not to burn in the sun. But you need to get that Viderma because it's so good for you. Okay? Okay, let's go to the next one. Sophie, what would cause bruising that I never had before, now I have? Well, look, one thing about Sophie, get it checked, because sometimes that can be a sign of a very of not good things, including cancer. So get it checked, Sophie. If you never had bruising before and now you easily bruise, I would have that checked, okay? 1. 2, sometimes after you've been on meds for a while, so I don't know, Sophie, you got to answer those questions yourself. Sometimes medication, even though it didn't bother you before, would make you like, if you're taking an aspirin or any kind of blood thinner, steroids of any kind, antibiotics, I've seen that happen, can cause bruising. Tylenol. It never bothered you before. But, I take Tylenol because I get headaches a lot or whatever. Now you start, and it can gum up the liver, and that can change things. So all I'm saying is, you got to answer those questions, Sophie, because I would do a deep dive. Make sure that it's nothing serious. Sometimes you're getting a reaction to meds. So check that out too, okay? Melissa, what is your stance on nitrates and additives in processed meats? Well, look, nitrates, by the way, in case, I've mentioned this before, Melissa, but when you eat vegetables, you get nitrates, okay? So I'm not too concerned. They made a big thing about that, I don't know, 20 years ago. It stopped a lot of people from eating bacon. It did. Nitrates, okay? What are nitrates? Well, when you eat vegetables, you get nitrates. Now, I'm not too worried about nitrates, to be honest with you, okay? Now, I would rather you have better cuts of meat. But you asked the question, let me finish. I got to finish this. What is your stance on nitrates and additives in processed meats and how they contribute to insulin resistance? Well, they don't. Look, all I'm saying, Melissa, and I'm not dismissing your question, okay? Please, don't take it the wrong way. When I teach, I must speak in broad terms. I hope you understand that. You don't hear me often talking about go get organic meat. Okay? Preferably, yes, of course. Of course. If you can afford it, if you got a butcher living next door to you, you live off a farm, and the farmer down the street, you can go buy your meat and vegetables from him and all this and that, or her. Guys, great. But you have to understand, for me, we get to 50, 60,000 people every week. Up to almost 3 million downloads. I speak, Melissa, in generalities. And you're better off eating a piece of processed meat than you are eating a piece of bread. And I don't care if it's 17 grains. And the reason is, Melissa, because of insulin. And the biggest problem, I wrote the book, The Reset. I tried to prove my point that the biggest problem in our society today is not a virus. It is metabolic syndrome. It's killing people a lot more than the viruses. Well, as a matter of fact, you can't even get the virus pretty well and make you really sick, or hospitalized, without getting metabolic syndrome first. Metabolic syndrome is caused by sugar, crappy carbohydrates, okay, made with vegetable oils. This is the scourge in our society, not processed meats. When you have bacon, okay, is it pure? Is it, look, I want kids to eat bacon and processed meats. Now, I would rather they go to the butcher and get that cut right in front of them. But when it comes to comparing, there's no comparison. And I always laughed about the nitrates because nitrates, when you have vegetables, you get nitrates. Like they made nitrates the boogeyman. They're not the boogeyman. What does it do to you? What do vegetables do to you? They don't hurt you. So anyway, the process, I get it, okay? And Melissa, I appreciate the question. I really do. But again, you have to understand where I come from. I am laser focused on getting your insulin down. Tackle that problem. You know, if you're on the Titanic, don't worry about the deck chairs. Change course. And if you already have, then you can start, yeah, you know what? Every piece of meat that I'm going to eat is going to be the best cuts and the best, and organic and whatever. If you can afford that, and you can, I talk to people every day, Melissa, who are on the Titanic. They are in deep trouble. And I say, look, man, I can't make it complicated. I have to simplify it and say, you eat eggs, meat, and cheese and watch what happens to your body. You will not believe the changes. So that's me. But I get it. And I appreciate you asking the question because I like to get people to understand where I'm coming from. And I think, Melissa, you opened that door for me to, again, preach to the basics. Get your foundation. And then you can do tweaking. I got no problem with that. Okay? I got no problem with that. Okay. How good is A1C for diagnosing diabetes? Well, it's a lot better than just blood sugar. A1C is an average of your blood sugars for over 3 months because they follow your red blood cells along. And then a person who has some kind of hemolytic disease like thalassemia, like Mimi's asking, would that change that? No, it shouldn't change it, even though that can give you a red blood cell disorder. But your A1C, it's sugar that attaches to them. And they never let go. When sugar grabs a hold of hemoglobin, which is part of the red blood cell, it never lets go. So, do I like A1C? Yeah, I tell you that. If you're going to send me blood work, I'm looking for A1C. Blood glucose, man, not so much. I'm looking at your A1C because it gives me a better average. And I've done a program on this, if you want to go back. And I talked about the newest research on A1C. If you're over 4.7, you're starting to get insulin resistance. You know, and that's well within, that is well within normal limits, according to the blood work. But according to the latest research, when you're in the 5s and the A1C, you're in trouble. You need to change. You're a lot closer to diabetes than you think you are for a lot of people. Okay? Good question. Janine, I used to have painful episodes in my knee for a year. 1 week pain and 1 week without pain. I noticed the last 3 months, no pain at all. Wondering if the vitamin D and vitamin K2 can work that fast. Yep. Yep. Vitamin D is very anti-inflammatory. Why do you think I love Viderma so much? And vitamin D is tremendously anti-inflammatory. It is good for everything, from your brain to your toes, from your joints to your muscles. Guys, from your immune system, you name it, and vitamin D just about does it. You are a human solar panel. Now, why do I like vitamin K2? Because vitamin K2, which we put in our vitamin D, by the way, vitamin K2 takes calcium out of your arteries and puts it where it belongs, in your teeth, in your bones, where it belongs. Calcium is good for you, by the way, but not when it's in your blood vessels. That's why I'm not big on taking calcium as a supplement. Eat your calcium, because when you eat your calcium, see what God does? You eat butter, you eat cheese, okay? And dairy. Well, God puts vitamin K2 in that so that it would naturally takes the calcium you're eating and puts it where it belongs. Nature's got it right. Osteoporosis is not a lack of calcium. It's not. Okay? It's not. Okay, good questions. But yeah, vitamin D for some works rapidly. Rapidly. Sarah, canker sores for her husband. Yeah, they're no fun. But I always go to you know what? When you get repeated cankers, your microbiome, by the way, is not right. It's a sign of leaky gut. It's a sign of leaky gut. Because your microbiome, they communicate with all the other bacteria. It's almost like they message each other. You know how you message on your phone? Well, your microbiome in your gut messages the microbiome in your mouth and your brain and on your skin, and they talk to each other. It's amazing. But when your microbiome in your gut is disturbed through antibiotics, bad eating, feeding the bad bears sugar, feeds yeast and that can cause certain people to make a lot of cankers. And when they clean up their diet, it's amazing what it helps. Secondly, I would open up a probiotic for your hubby and let him some of that powder in the mouth. Put it right on the canker. You know what else is good? Oil of oregano. You know why oil of oregano is so good and I like it so much? Because it can differentiate. You see, again, it's in nature. God gave it to us. And what happens with oil of oregano? It kills your bad guys, but not your good guys. It knows. It don't kill your good guys. It kills your bad guys. So I would swish oil of oregano and probiotic right in the mouth. Open up a little bit of the capsule and put that probiotic right in there and fix the gut. Probiotics inside and out. Sometimes with cankers too. It's low levels of vitamin D. Sometimes with cankers too. It's low levels of B12. That's been my experience when I tested patients. Because I was looking for deficiencies. And often they had that. Okay? And the diet's really important. And a couple of those little tricks there. Okay? Okay. Thanks, Sarah, for the question. Tina, functional movement disorder, beside the reset, what supplements? So again, these are just like spastic movements, neurological. Always look, Tina, I always look at deficiencies. Here's what I found over the years. Generally, they had leaky gut. They had a huge amount of yeast or candida. That's what I found, okay? It's not always the case, but I found that. And the other thing is they were usually anything neurological, look at the neurological vitamin, which is B12. Okay? Look at the neurological vitamin of B12. Okay? Oh, wait a minute. Well, Farida, I'll do yours, and then Jenny, I'm going to come to you. B12, my B12, Farida is saying, my B12 was 1475, and I stopped taking it. I would like to know how long I should stop. Maybe for about a month. But here's what you need to understand with B12, okay? B12 is a water-soluble vitamin. The test for B12 is 100 years old. Okay? it's highly unreliable. And I always talk, Farida, about optimizing B12. So at 1400, I like between 800 and 1200. If it's at 1400, just stop. You don't need it right now. But the other thing is, remember, B12's water soluble. What's that mean? It means you are not getting toxic on B12. I know why you're sick. You're taking too much B12. Now, you know, if your number's up there, your body is taking it in and not peeing it out. It's probably because you needed it big time. So, Farida, look, stop for a month, start up again, and when you feel good taking it, because a lot of people realize once they take B12 and how much better they feel, don't worry about the number too much, okay? Because numbers are what laboratories are into. Labs live on numbers. Doctors, the old-fashioned doctors, okay? They didn't live on numbers. They lived by, how are you feeling? Oh, I feel real tired, doc. Okay. Well, your numbers at the lab are not telling me that, but, there's something wrong because you're not feeling good. Oh, doc, I feel great. Oh, but your numbers are telling me your B12's too high. Well, don't worry about it too much, Farida. Okay? I remember having a conversation with a physician. She was actually a patient of mine. And we had a mutual patient about a month after she came to see me, this physician. And she said, she phoned me, Doc, Susie, or whatever her name was, she's got high B12. And there was dead silence on the other end of the phone. Like me, I'm waiting. And I said, Doc, so what's that mean? Well, it's high. The lab flagged it. What do I do? She said, with this patient. I said, how is she feeling? And she said, well, she's feeling very good. I said, well, I wouldn't worry about it too much. And I said, Doc, remember, B12's a water-soluble vitamin. The body won't become toxic. It'll pee it out. And, anyway, she was very open to what, she was already a patient of mine. So I said, I wouldn't worry about it too much, Doc. You know what I told you when you were in the clinic? I wanted you to get your numbers up. You had low numbers of B12. They weren't optimized. They were normal, but who made the normal? It's 100 years old normal. Okay. And Ginny, because you were asking the question before Farida, but anyways, I wanted to go on the B12 since I was on the subject. Ginny, is it all right to take red yeast rice to lower cholesterol? That's a supplement. Why do you want to lower your cholesterol, Ginny? I think you know me enough, and I'm teasing a little bit because, get your cholesterol down, get your cholesterol down. No, get your triglycerides down and get your cholesterol, your HDL especially, up. So when you have a supplement that says this will lower your cholesterol, why are you trying to do that? Now, I don't mean to, I'm not coming after you personally, Ginny, okay? I'm not. I'm just making a point, and I can't get excited about lowering cholesterol. I just don't. To me, it's very bad science. It's very bad science. And I wouldn't worry, if you want, Ginny, send me your blood work. Tell me what your triglycerides are, and I will look for your HDL, and then I'll tell you what to do. Okay? I'll tell you what to do. But I'm not big on lowering your cholesterol. It's looking for love in all the wrong places. It's not doing what you're not fixing. What are you fixing? Every part of your body needs cholesterol. Your cells need cholesterol. Your skin needs cholesterol. Your brain needs cholesterol. Your hormones don't work properly without cholesterol. Why are we insisting on lowering it? I asked the question to my doctor friends. Why are you insisting on lowering cholesterol? Heart disease, doc, heart disease. And no, it's been a colossal failure brought to you by the pharmaceutical companies that make statin drugs. I hate to be negative. I'm not negative. I'm a very optimistic guy. Jocelyn, my husband heard on weightlifting YouTube taking supplements, did they break a fast? Well, look, technically, if you take, let's say, for example, you take a high DHA supplement, technically, you're breaking a fast. And let me just do a second of teaching on this, okay? Let me do a second of teaching on this. Because even with intermittent fasting, if you want to be dogmatic about it, you would really only be drinking water to be dogmatic. Now, the reset is fasting without fasting. Because the idea with the reset is you're hardly secreting any insulin. So the key is when you space out your food, like let's say you stopped eating, 6 o'clock at night, and you go to 8 o'clock the next morning, you've now gone 14 hours. Now you're into technically what they call intermittent fasting. Do I like it? Yeah, I like it. But you can do fasting without being dogmatic about it. Because then you'd never take supplements. You're going to drink water and black coffee. But I don't preach that so much because I know from my experience that you are really still fasting when you take your supplements. You know what, folks? I take my supplements in the morning. Why do I do that? Because I'm a senior and I'm liable to forget. Okay? So, technically, yes, but in reality, no. Okay? In reality, no. So, okay. Now, I got a lot of questions to go, and I'm running out of time. Yeah, I got a lot of them. Okay, so I'm going to come back next week and answer some of these questions, but let me just give you one of them. I'm going to answer this one because, there's two of them. Let me answer this because Nicole asked the question, and it really goes in with the question asked by Jocelyn, okay, in this sense, okay? About what we were talking about earlier with calories. That's what it was. Okay. Nicole says this. Someone told me I needed to eat carbs to process protein in my muscles. Is that true? No, that's not true. You don't remember what Dr. Martin's saying? If your body needs glucose, it will take steak and make it glucose. Okay? And I talked to you about yesterday the huge difference between insulin driving amino acids into your muscles and into your cells. Much better fuel. So you don't need carbs in that sense. If you never ate another carb in your life, I'm not saying you won't. I'm just saying if you, let's say you lived in the North Pole and there was no carbs. You would just had to live on fish and seal and whales and whatever they eat. You would live very well without a carbohydrate. And the reason is because your body's so smart. It will take steak and turn it into sugar if your body needs it. Okay? If your body needs it. But there's a lot of stuff out there it's nonsense in a lot of ways. It really is. And you don't need that, okay? Now, one more question, because I wanted sort of to get to this and then, because I think it had to do with, hold on a second here. Yeah, that's the question I wanted to answer there. And, okay, let's leave it at that. Let's leave it at that. There's 3 or 4 others, and I promise to take them up, okay? Now, you guys have a great day, okay? If you got sun in your area, get out and get 20 minutes, 30 minutes, 40 minutes, 20 minutes gives you 10,000 IUs, and you never overdose on the vitamin D that you get from the sun. You never do. Your body knows exactly how much it needs. Isn't that amazing about the sun? Okay? Isn't that amazing? Your solar panels turn off when they don't need any more. They're filled up. I love that. Okay? But 20 minutes, 10,000 IUs. Okay? And people are scared skinny. Oh, I take 1,000 IUs of vitamin D, doc. I take 1,000. Okay? That's for mice. Okay? That's for mice. Anyway, I don't want to get into it. Okay. Love you guys. Talk to you soon.